occupation-specific conditions. Different professions require different physical demands on a body. As a massage therapist, you're well aware of the beating that our bodies take in performing our daily functions. When you deal with other professions, and the first one that comes to mind to me are dentists. They tend to be, in some respects, like us, that they deal one-on-one with the patient directly, and their body mechanics are very, very important to how they feel at the end of the day. They stand for long periods of time or sit for long periods of time in the same position, usually at an awkward position, excavating someone's mouth. So they tend to use one side of their body more than the other side. They tend to twist and stay in a twisted position for a long time. They hold vibrating tools, which causes peripheral neuropathy in the hands. It can cause irritation to the nerves all the way up to the shoulder and the neck. So understanding the components of someone's job can be vital to figuring out what you could do or what possible changes they could make too in their ergonomic situation to make it better. Another profession that comes to mind is a gynecologist. They tend to have a lot of back and neck issues and shoulder issues because they pretty much become contortionists to do their jobs. People with manual labor jobs or physical jobs, construction workers, mechanics. Mechanics are bent over cars or sometimes crawling into or under engines all the time. They have a lot of wear and tear on their body. Tree surgeons, up and down trees, climbing, also holding vibrating tools, along with mechanics, people who paint cars, people who do all sorts of things that are manual type labor, that use tools a lot, tend to have a lot of issues with their hands, with their arms, and neuropathy either throughout the day or at the end of the day or upon resting. When they wake up, sometimes they wake up in pain just as the demands of their job build up in their body. Understanding what they do for a living, understanding what they do for play can dramatically guide your treatment. It can dramatically affect the suggestions that you give them to help improve their overall situation. How comfortable do you feel with that? You need some help with that in your continuing education department. Once again, make your continuing education choices very, very carefully. Make them count. Look at your current client base and decide who you might want to attract as a client or a patient, and decide then if you have the skill set that you need to handle this, and where do you get the skills if you don't feel very comfortable with it. Integrated Touch Education Services is very, very therapeutically based in all of our classes, and very much deals with and copes with the reality of people who work physically with their bodies. Give us a call. We can probably help. Check out our website. I'm sure we have a class that will interest you.